Buenos días.
Good morning. My name is Carlos Caballero. I'm a paramedic and a qualified nurse, and I work as a first responder here in Mexico City. In the mornings, the first thing we do is check over our equipment.
Terminamos nuestra revisión.
Our check is finished. We've got our isolation bed ready for COVID patients, so now we have to refill our oxygen tanks. So let's go.
Acompáñenme, por favor. Vamos. Sí, ha sido unos...
These have been very difficult times for us. The work has been very intense. We've been all over the city attending to patients, and unfortunately we've seen a lot of COVID-19 victims.
También te das cuenta de que la gente...
A lot of people here have been ignoring the sanitary guidelines, and that is very disappointing for us, because if an individual gets sick, that's their own responsibility, but they also become a danger to their families and then the medical staff who are helping them. It's frustrating because people put themselves at risk unnecessarily when I'm forced to put myself at risk every day.
¿Y qué hizo reuniones o qué andan? ¿Cargamos combustible?
So now we're waiting on our first call, but first we have to know if there's a hospital that will receive our patient, and that's the hardest thing at the moment. But the person who takes care of that is Fernando Aviles.
Ha sido terrible.
This pandemic has been terrible. Many patients. All of them gravely ill. The hospitals are full, so we can spend hours calling many different hospitals, with all of them telling us they have no space. And all that time, we have a patient in our ambulance.
The patient is 88 years old and has diabetes.
I'm on my way. Mexico City is by far the most infected part of the country. And even though our medical staff use protective equipment, they are still the most at risk of contagion because they are constantly in contact with infected patients. The patient is elderly. They have presented with hypoglycemia. Their glucose is extremely high, but they also have bad respiratory problems, low blood oxygen saturation, so they are almost certainly infected with COVID. They have a hospital bed waiting for them, so we're heading straight there. We haven't seen any recognition from the public for the work we do. We don't expect it. I don't think us paramedics are heroes. The real heroes are the doctors and nurses who are with these patients for days at a time. We're only with them for a couple of minutes.
No ves a tu familia. Tu familia no te ve.
You don't see your family, and your family don't see you, and if you get sick, you don't get the chance to say goodbye. Those who come to see you, they can't recognise you because you're in full protective clothing, so it's difficult, and it makes you scared.
Es difícil y sí te da miedo.
Alasdair, Baverstock, CGTN, Mexico City.